You need those kinds of breaks. I think it would be honest to say that he isn't everybody's cup of tea, and there's no doubt if you or I were hit by a truck, the first person we see when we come into the emergency room probably shouldn't be Doc Willikers.
And she's in room 9.
He is a little bit of a fumbly doctor, I would have to say.
Well, one feels he probably graduated from Disneyland or somewhere similar, but he is actually very knowledgeable.
Oh, well, my professional training, of course, I've been to all the best schools and all the best hospitals.
He does think he has all the answers, and in fact, I think he's pretty good at flirting 101 versus maybe IVs 101.
When you meet Doc Willikers, there's a comfort level in that he's slightly shambolic, you know, not the smartest dresser. His equipment is not totally up to date, but you know immediately that his heart's in the right place and that he's there for you.
Whew, boy.
This guy, Doc Willikers, showed up in 1994. He actually came the first time to the hospital as Doc Willikers. He turned up in costume one day, which is usually a little unprecedented.
I'm like what they call a thrift store clown, in that I go into thrift stores and I look at old clothes and I try them on, and if something speaks to me, if I think it looks funny, I just put it on, and I just created Doctor. And once I looked in the mirror and thought, there I am.
And I'll admit, I was probably one of the skeptics when he first started here. But needless to say, he made an incredible impact on us. And once we met him and had spent a little bit of time exploring what it is that he did, we looked into actually funding Doc to come on a regular basis.
I don't know who made the decision. I was delighted when I bumped into Doc Willikers in the elevator.
The day that he's here, everybody knows it. It's marked on the calendar. Everybody just knows Thursday is Doc Willikers' day.
In 1995, Paul Hewson joined the Child Life Department of Vancouver Children's Hospital as a therapeutic clown.
Now, Tracy's just asked me to come in and see somebody around the corner, so I just wanted to let you know that I'm on the ward, in case there's any emergencies.
The Child Life Department has two main goals. So one is to help children and families cope with being in the hospital, and the other is to provide a normal experience for children in what is actually a very abnormal environment.
I haven't checked yet. Now,
We work as a team. Doc is part of that team.
I'm just going to wash up.
Therapeutic clowns became well known because of the movie Patch Adams, but Paul Hewson is quick to point out the differences between Patch Adams and himself.
He's actually a doctor being a clown, and I am a clown being a doctor in the simplest terms. I don't have a medical degree. I don't understand medically what's happening with people.
Hey, Ryan, you just blow a bubble.
Probably the most valuable thing that I do is just provide relief.
Right. Do you remember me? Let's come this way. Here.
Children vary. Some burst into laughter immediately, others are a little taken aback and are silent, but very quickly he works them through to a mood where they're totally removed from their immediate environment.
All right, beautiful.
When a diagnosis is made and the child is having to undergo a tremendous number of invasive medical procedures and treatments that can be painful and uncomfortable and make them very, very ill, any serious life-threatening disease is a shock for the family.
Hospitals are very stressful. Most kids coming here have no idea that they're going to see about 150 people in their first hour or so that they're in a hospital. So they are very much bombarded by information overload, and families are getting all kinds of things coming at them.
For most of the children here, it's a hard time. They don't enjoy being here. It's a pretty boring environment too. Like there's not a lot of change in your day-to-day routine.
A head brace helps strengthen the spine of Mitchell Lockhart, whose favorite visitor is Doc Willikers.
It's really nice to have someone come in and help you, get your child in a better mood. Once a child's in a good mood, they forget about everything else that's going on. There's nothing better than seeing your children laughing and happy, because then it's less stress for me. He's not upset and crying, and he's ready to play and be in a good mood.
Bye-bye now. Bye-bye. See you, Mitch. Bye-bye. See you later, alligator. Oh, ow. Okie doke, here we go. Beautiful. Hey! Hey!
She asked for him as soon as she came into the hospital if Doc was going to come by and visit. So I asked the nurses today, and when they told me that he was coming, it just made me happy, and kept telling her, take your pill, Doc Willikers is going to be coming soon.
Hey!
4-year-old Faith Gervin has leukemia, and there's nothing she looks forward to more than a visit from Doc Willikers.
I almost peed my bed.
Why?
Because he made me laugh so hard.
They're totally clean. Are these clean?
No.
Oh, I'm gonna have to use the special cleaner. Here we go, the special cleaner. Excellent.
It's a very stressful time for the parents to be here with their kids, and when someone comes into the room and makes them laugh as hard as he makes them laugh, it brought tears to my eyes the first time that he was here doing that. So, yeah, it still does.
Those moments of normality for children to be children and for parents to enjoy their children being children, these are magical. These are elements of therapy that you can't actually put a price on. Humor is the emotional Prozac that we all need.
I know, it's so nice.
I think humor has truly a therapeutic effect in terms of your ability to cope with your illness and to recover from your illness or accept your illness.
He's just the type of personality that makes this kind of thing work.
Hi there, sir.
And I think some of that is just intrinsic, and some of that is in the training that he has had.
I don't have any training, but don't tell anybody.
This is just, looks a little bit like an ice cube, right, Paige? Okay, so we take it, we scrunch it. Now just gently blow on my hand. Holy smokes. Did you know you could do?
My background as a clown, I've been clowning 30 years now. I started out as a mime. I studied with Marcel Marceau in Paris for a year and with other people, and came back to Canada to try to make a living as a mime, and discovered I was actually a clown. They have a saying, you don't choose to be a clown, it chooses you, and truly it chose me. Clowns can get children to trust them. You're not a medical staff member as such. You're a figure of fun. Immediately they sense that you're there for other purposes than a medical purpose.
Are you a teenager? Yeah. Oh, see, if I'd known that, I wouldn't have done the stupid jokes. Here.
What you're trying to do is achieve low status. You're trying to have the kids achieve high status. You always want them to, you go in there assuming you're smart, you're high status character, and quickly it becomes obvious that you're not.
Oh, he doesn't look old enough to be a dad, does he? He's too good looking.
Doc endears himself to most of the kids who he encounters, and actually not just the children who come here, families, nurses, basically anybody that he encounters.
You know why they normally don't let pets in the hospital? Now this is not common knowledge, but see ooh, yuck! He pooped right in my...
And really, I think even some of the older youth in the hospital that you wouldn't typically think would sort of go for a clown coming by, he has some really big fans on the adolescent area, and ones that just look forward to having him come back.
Are you married? No. Oh, excellent. You gotta jump on the moment, okay? Oh, Paige, always What?
Actually, one of the most humorous interactions I ever saw was actually not with a patient, but with a nurse who he proposed to. And Doc has this elaborate diamond engagement ring, and he got down on bended knee, and I have never seen a nurse blush like, I mean, just 40 shades of red. She was so thrilled that she got to keep the ring. Eventually had to give it back. But this nurse had actually never been married before. It was her first proposal. And it was probably one of the most touching moments it was lovely.
Are you married, madam?
No.
Oh, excellent. Should I marry her, Faith?
It's fun to see, you know, a nurse a little bit embarrassed that the doctor has asked her to marry him. It's fun to see the doctor squirted with some water.
Are you always this truthful, madam?
That looks like such a beautiful
Here we go.
ring.
I think when he comes in, staff are able to loosen up a little bit. They can put some of the serious stuff aside and be able to interact with the kids and families in a way that is just more of a playful nature.
Don't peek. Do a little trim at the back.
Being frightfully uptight and very British, it was highly odd to sort of have somebody poke a tendon hammer into my ribs and fiddle with my stethoscope and pull my name badge up to sort of an inch from his nose. But I realized quite quickly how positive the interaction was.
Let's see your bum go.
He brings joy, and that helps, even when they're feeling down or just having like a really rough day.
Yes, excellent.
One of the first children that I worked with years and years ago, she was a teenager. She had a bone marrow transplant, and it didn't work, right? So I've been, you know, playing with her for months and months and months, and you know, at the time when she was getting close to dying, she just turned. I was in the room. She's looking at me, and her mom's there, and her mom's like, of course, really trying to get things going, you know, and she was just too tired and too sick. And she turned to me at one moment and said, "Doc, could you just make my mom laugh?" You know, which was an amazing statement of letting go. She was old enough to know that she was nearing the end of her life, but she wanted to do something for her mom. She loved her mom that much. I mean, look at the gift that girl gave to me. You know, it was, and they give these gifts every day.
You put the hair on, okay? Go like this. You give him some hair. I do the hair.
He does get to know these patients so well while they're here in the hospital. And, you know, he can't help but get moved by those experiences as well. And unfortunately, I mean, we do have some patients that don't leave here, and he's very moved by those things and the effect that he's had on those children's lives.
James was born with a rare disorder that has forced him and his mother to live in the hospital for most of his life. Doc's visits are the highlight of his day.
When I go into intensive care, a lot of the kids in intensive care are very, very young. They're babies, or they're really young kids. Medically, they have a lot of stuff going on, and it's a hard thing to do. It takes a lot of bolstering my courage to go in. But there's a time when being funny isn't important. Just playing the song and just, just sitting down beside the bed and just talking with them. I've known a lot of kids that have died at this point, and they were my friends, I'm constantly trying to figure out, how do you deal with dying children? How do you make their life easier? Sometimes I succeed, sometimes I don't. Sometimes I don't have the courage to try. But I'm human too. Yeah.
I think it is something really special that takes place between Doc and the patients here that really I haven't seen replicated.
He is a different person from me, and I don't know where he comes from, but I like him, and a lot of people like him, and I want to hang around with him.
Misery may love company, But laughter is contagious. It all depends.